Hi friends, here I am again with some Nclex questions, some adult nursing Nclex questions. So let's straight away go to the questions. The first question is, a 50-year-old client is coming to you with a severe vomiting and diarrhea. The admission pulse pressure is 90/70 and the pulse rate is 120. You already gave this patient 2 liters of normal saline. Now you are checking whether the patient has got adequately rehydrated. So you are checking some of the parameters which shows that the patient is adequately rehydrated. So I'm going to give you the options. We have 5 options here. The first option is capillary refill is less than 3 seconds. The second option is pulse pressure is narrowed. The third option is systolic blood pressure drops only when standing. The fourth option is urine output is 360 ml in 4 hours. So the fifth option is urine specific gravity is 1.020. So let's start eliminating or adding to our correct answers. So this is a SATA questions. This question answer has more weightage compared to single answers, because the more SATA questions are asked, that means if you are going good with the answering in Nclex, if you get more and more SATA questions, that means you are going good, your exam is going good. If your exam pattern is going like a less tough questions, like easy questions and more single question, that means your exam curve is in lower side. So you have to get all the answers correct. If there is 3 answers correct in this, you should choose all 3 of them. Okay, so let's go. So it's a select all the SATA questions, so select all that apply. So let's go to the first option. Capillary refill is less than 3 seconds. So capillary refill less than 3 seconds is a normal scenario. It's normally rehydrated. It's a hydrated scenario. So that is a, because this patient came as a severe hypovolemia, and if the patient is showing is well hydrated situation, less than 3 seconds the refilling is taking place, that means that's a correct option. Pulse pressure is narrowed. What is pulse pressure? Pulse pressure is the difference between systolic and diastolic. If pulse pressure is narrow, means it's automatically it happens with the hypovolemia. If patient was in shock and hypovolemia and severe dehydration, the pulse pressure will be the difference between the systolic and diastolic pulse pressure will be narrowed. So this is only 20 here. This is 90/70. So that is not a corruption. The patient was not well hydrated. That means the patient still in hypovolemic shock. So that you can eliminate, the second option. The third is systolic blood pressure drops when standing. Do you think this is an this scenario is related to this one? Systolic blood pressure dropping is a different situation. It happens with orthostatic hypotension. You know what happens normally in our body due to gravity. When you stand up, due to gravity, our body mechanism is a normal response. Make vasoconstriction and systolic drops. That's a very normal thing. But it's not here. In this patient was hypovolemic and came, and this is not a scenario here. So we are not dealing with the systolic blood pressure drop when standing. We are not dealing with that problem. We are dealing with a hypovolemic shock. So that you can eliminate. That vasoconstriction takes place. Here in what happens is, when a patient is really in a hypovolemic shock, normal response to that, body do the maximum vasoconstriction. Body can't do much more when stand up to make a difference. No, it's already when the patient is lying down itself, body made enough vasoconstriction to compensate with this fluid loss. So this is not a correct option here. Then urine output 60 ml in 4 hours. So our normal, what is our normal output in 30 ml per hour is expected normal output for an adult. Yeah. So this one is 360 ml per hour, means patient is having about 90 ml per hour urine output. That means much more than what we are expecting. So urine output is a direct indicator that the patient was adequately rehydrated. And the fifth option is urine specific gravity is 1.02. So urine specific gravity normally is 1.003 to 1.030. So it's normal. So our three correct options here are capillary refill is less than 3 seconds is a correct option. Option number 4 is urine output is 360 ml in 24 hours. That's a correct option. And the fifth option is for urine specific gravity is 1.020 is a correct option. Okay. So those are the indicators that the patient got adequately rehydrated. Okay, let's go to the next question. A client with an implantable cardioverter defibrillator develops ventricular tachycardia. So the patient already have a device. Okay, so that device is that device is, so implantable cardioverter is a device, is a medical device that is surgically implanted underneath the skin that can sense life-threatening arrhythmia and discharge electrical shock directly into the cardiac muscle to correct the arrhythmia. So that is what the ICD is doing for the patient when they have arrhythmias. When they sense it and then they detect there is a sustained or a reoccurring arrhythmia happens, this ICD start firing. Okay. Client typically receive ICD after a history of sustained or recurrent ventricular tachycardia. When ventricular tachycardia develops, these machines kick in and it fire. Okay, including personal or family history of sudden death or cardiac death, severe failure, heart failure, and that all these cases we do ICDs for the patient, and this ICD kick in when the patient develop VT. So here in our situation, this patient has an ICD and the ICD fires multiple times without successful stopping the VT. So the ICD is working, but what it happens is it is not successful in stopping the VT. Ventricular tachycardia is not getting corrected. It's VT is going on, causing the client to become more confused and difficult to rest. So patient is going, it's like going into unconscious level, like confused and difficult to arouse. So which action the nurse should do? It's a life-saving situation. So you have to prioritize what is the primary thing that nurse has to do here. So that's what you are focusing on. So what your options are: attempt to stimulate a vagal response by having the client cough. Is this the one you are supposed to do at first? Keep that little away. Let's go to the next one. Deactivate the client's implantable cardioverter defibrillator with an external magnet. Think, is this the one I have to do at this point, the first thing? The third option, obtain a STAT 12 lead ECG to verify the cardiac rhythm. Think about that too. Is this the first thing I have to do here? Fourth option, prepare for synchronized cardioversion with the external defibrillator. So, if something which is implanted, it is not means it's working, but it is not stopping what it's supposed to. If it is not functioning effectively for what we are supposed to keep that device, what we have to do? We have to search for an alternative fast, yeah, because it's a life-saving situation. We may lose this patient within no time. It's a VT. If continuously go, patient will collapse and cardiac arrest and done. So that could be the external finding getting a external defibrillator and prepare for synchronized cardioversion with an external defibrillator, the correct option here. Okay, so let's see why one was not correct. Means attempt to stimulate a vagal response by having a client cough. Why it is not correct? It is inappropriate intervention for this is intervention here. Stimulating a vagal response, example coughing, is an appropriate intervention for supraventricular tachycardia. SVT, not VT, okay? It's asking the patient to cough, stimulate the vagal nerve, that is for the supraventricular tachycardia, not for ventricular tachycardia. Ventricular fibrillation, okay, not for VT. Ventricular tachycardia, sorry. Then the why second and third options are wrong. Deactivating the ICD and obtaining an ECG are not appropriate at this time because they delay life-saving intervention. As I was telling you, this every second is counted here. You have to act quick and fast. So otherwise you will lose this patient. Yeah, so something very serious and critical at this situation, what you have to do is prepare for a synchronized cardioversion with an external fibrillation. Act quickly, quick, okay, that's what you have to do here. So here an implantable cardioverter defibrillation is a device used to sense life-threatening arrhythmia and discharge electrical shock to correct the arrhythmia. If the client experiences repeated ICD shocks without dysrhythmia resolution, the nurse should obtain a manual external defibrillator and initiate cardiac life support. Okay, thanks for watching guys. See you with the next video soon.